investigations. Her hemoglobin is 6.5 gram percent. Total leukocyte count 6,800 per cubic millimeter. Platelet 1.8 lakh per cubic millimeter. MCV 72 femtoliter, MCH 24.3, MCHC 29%, hematocrit is 22%, Mentzer's index is 21. Serum bilirubin is 0.6 milligram per deciliter. Blood group A positive. Her DIPSI value was 136 gram per deciliter. Urine routine micro is within normal limits, and the serum LDH is 147 intrash units per liter. Peripheral smear shows microcytic hypochromic RBCs with anisocytosis with a normal platelet count. Her provisional diagnosis is a 30-year-old female with 30 weeks, 3 days pregnancy in the case of third gravida with a single live intrauterine fetus in cephalic presentation with severe anemia, iron deficiency anemia, not in heart failure.
Okay, yeah. So very good. You have given complete details. Can you just go back to the slide on results? Yeah, basically. So this part, I mean, a little bit, you have to be careful because in the examination here, Tejas has been given these findings, but in the exam, sometimes you may not be given these findings. So they will ask you about the clinical diagnosis. So from Peller and like, you know, your clinical examination and from history, like e.g. fatigability in this case. So you may be able to reach a diagnosis of, you know, anemia in pregnancy, most probably iron deficiency, not in failure. But you may not be able to tell about 6.5 gram percent. They may not give you this finding. They may give you just 1 or 2 finding. Okay, hemoglobin is 6.5 gram, not minute detail of DIPSI or all other Menzer index, etc. So this you have to be careful that these details may not be available in the exam. You have to rely upon, and you are not supposed to see from the file of the patient. And if you have an access to the file, you are not supposed to see. So you have to. They will give you that this is the patient. You are not given any detail of the any file with you, okay, and then they will give you one slip that these are the investigation finding, or you can ask also in exam as a student that, you know, I mean, will you be providing me any investigation? So they say, okay, yes, hemoglobin is 7 gram or whatever, and that's all. So then you have to, like, when we are taking case viva from you in that particular case, like discussion, in that case, I mean, the examiner will ask you, what investigation will you do? You know, and then so that you have to be prepared for that. Okay.